With you 16 amazing health benefits of moringa you should know. Number 1. Control of diabetes. A review paper shows that moringa leaves to protect against diabetes. Moringa reduces blood sugar levels because of its insulin-like proteins. It improves hemoglobin levels. The high blood sugar level leads to diabetes. It's important to keep blood sugar at healthy levels. According to some studies, moringa might help to lower blood sugar levels. Scientists believe that isothiocyanates in Moringa oleifera make it effective against diabetes. Most of the studies are animal-based. Only a few of them are conducted in humans, but they are generally of low quality. Number 2. Protects from cancer. Study shows the effects of moringa extract that its root core kills different types of cancer cell lines. From some lab tests, it's proven that it slows down the growth of pancreatic cancer cells. It helps to prevent cancer cell development with the help of a substance called niacinamide, present in moringa. Vitamin C and vitamin A present in moringa act as an antioxidant and protects the cell from damage caused by free radicals, thus lowering the risk of cancer development. Leaves of moringa contain amino acids which can be helpful for cancer patients undergoing chemotherapy, as it helps to improve the immune system. Do you find this video interesting so far? Please don't forget to subscribe to my channel. Hit the like button and ring the notification bell if you want to see more content like this. Number 3. Helps in lowering cholesterol. A high level of cholesterol increased the risk of heart disease. Certain human-based and animal studies have shown that moringa has properties that make it helpful for cholesterol-lowering effects. Powerful antioxidants in Moringa oleifera prevent cardiac damage, and certain studies also show that it helps maintain a healthy heart. Number 4. Control blood pressure. Moringa tea prepared from the ground and dehydrated moringa leaves are believed to help in lowering blood pressure. The antioxidative properties of moringa help BP patients to fight inflammation. It contains various phytochemicals like tannins, flavonoids, saponins, alkaloids, reducing sugar, and steroids. Flavonoid is the strongest antioxidant and has properties that help in bringing elevated blood pressure to a normal rate. Moringa leaves can be used as an alternative medicine for high blood pressure, as it gives fast and constant lowering of high blood pressure. Number 5. Good for skin and hair. If you want a natural glow and healthy skin, then moringa is a good choice, as its seed oil helps to remove toxins, and it has mega antioxidant levels properties for the skin. Moringa benefits also include its anti-aging properties. Nutrients and antioxidants in moringa act against free radicals and protect your hair, making it clean and healthy.
Okay, so welcome back. That was a short video of benefits of moringa. As like I said, we are going to have a wonderful guest, professional guest here to deliberate more on the topic infection. Exactly, this now one issue them we don't bother youths, elderly people, female, get any discrimination against anybody. So please make we wonderful guest introduce himself real quick. Yes, go ahead.
Good afternoon, viewers. I am Jesse Amara, Dr. Jesse Amara, currently a medical officer and recently been posted at the McKinney Government Hospital. So I'm here just to take you through the pathophysiology, pathogenesis, and the rest, complications, management and treatment of infection in women.
Okay, so there you have it. We have with us here Dr. Jesse Amara. So let's dive right in. So our first question, first of all, I'm very sure everyone out there would want to know and understand, what is infection? Like, what is this infection that everyone's talking about? Like, most people know that I have infection or whatever, but like, what is it?
Okay, so you saying infection, that's a very, very broad term.
Of course.
So, but for today, we will limit our topic to refer to infection in women, to be specific. All right. you have different type of infection based on the organ affected or the system compromised. So it has been broadly classified based on the causative organism. So you have infections that are caused by bacteria, you have infections that are caused by parasites, you have infections that are caused by fungi, by virus. Okay, so but mostly the menace in young women, we are going to focus on urinary tract infection, that's infections in the urinary tract, and sexually transmitted infection, which are very common among youths and among the young as well as the old in the world at large, not only in Sierra Leone. So infection is different from disease. Why? Mostly infections are asymptomatic. So what do we mean by asymptomatic? It means that you can have infection without any sign or symptom that you have it. You can be going about normal, you can be doing your things, except when screening are done at random, then it will be picked or deciphered that you are infected. Whereas there is no disease that you can have without signs or symptoms. So that's the difference. So that was the school of thought behind changing sexually transmitted disease into sexually transmitted infection, because there are infections that are transmitted sexually that one can contact without any signs or symptoms, but that doesn't mean you are free. So sexually transmitted disease was not appropriate in that sense, so it was later coined to sexually transmitted infection. So I will stop here for now then.
Okay. Can we switch to a local dialect so that yes, people out there would understand even better, all these medical terms. Yes. So in terms of this sexually transmitted infection, as you say, is it that women are more prone, or are they more liable than men to contact these? Because most time people are so careful, women especially, about infection. So is it that we are more prone or liable to having infection than men?
Okay, thank you. I thought you said we should switch to a local dialect.
I'm sorry.
Okay. Well,
okay.
Okay, so we'll talk now per Creole.
Yes,
okay?
yes, please.
So as I say, you get different type of infection.
Yes, as I say.
So if we talk about urinary tract infection, woman there most prone for get them than man. Okay?
What it make?
This now because of the anatomy of woman. You see, usai now make we say urinary tract infection. In other words, that sick way they get usai the piece where they affect usai wet the common. That part they now mean by urinary tract infection. If you watch how man in organ day, how God make them, in the outside a long that pipe, they will get the pipe where we get two pipe. We get the one where they connect from the kidney to the bladder, what we call the ureter in medicine. Then you get the other one where they come off from the bladder to the outside of the body, the other pipe, what we call the urethra. So the one first one I talk ureter in a ureter, then the other one I just talk where they come on in a urether. So the difference, okay? Because man in longer and it is outside of the body, so for let bacteria and virus come inside it and cause and can tap it and bond and multiply, it go act compared to how woman in the woman now in short. And direct as you come out outside and inside the direct you go now the ureter, you don't enter the body. So now that make for letting get infection, urinary tract infection, because of the anatomy, it very quick. Because I see the dirty come on and it go now that part, they don't itch inside the body. Whereas man I get for pass through the out the penis and go, and then a very long process we mostly can be difficult. So now that make any UTI when man gets, we can class them mostly as complicated. Because if we really don't be serious for let it show for let urinary tract infection showing man, rather than in woman, we can class them as complicated and uncomplicated based on the severity and the duration. Okay.
So which one are the complicated and uncomplicated now?
So as I say, based on the severity and the duration.
Okay.
So the complicated it can be more severe. Okay. Whereas the uncomplicated, I mean, could say uncomplicated. Even the English say we complicate. They say complicate. So
then
you know
exactly.
Then into serious. Okay.
Okay.
All right.
Okay. So like when you don't divide and so complicated and uncomplicated, in fever like they get types back of this infection. Yeah. So where they affect women them, especially in the urinary. I'm sorry. Tract. Yeah. So is there like we get types of infection which can affect women then that side?
Of course.
So one know which are the types of infection.
So as we say, if we don't class them as urinary tract infection, that we don't already specify say this that the urinary tract.
Yes.
Whereas if they come with sexually transmitted infection, you can classify them based on the causative organism. But one of the major cause of urinary tract infection in women now what we call E. coli. Okay, the bacteria we call E. coli.
Okay.
So as you remember our stats, I see you get different things the way they cause them.
Yes.
So I say bacteria, I say virus, and a class fungi. So you get E. coli, and you get Klebsiella. Okay. You get another some at times sexually transmitted infection also can lead to urinary tract infection. But as we go, we go talk about that because now process. Okay. As I say, we classify them into duration. We get the acute, okay, and the chronic. Acute means a short duration. Okay. Mostly where you can non-medical people where they can talk about chronic and acute. Like if you say when they say something chronic in chronic in bad past the acute, no, it don't necessarily mean so. Okay. Mostly the acute humans they can die mostly from acute causes of disease than chronic cause.
So like the acute, is it that you're able to get a quick and then it manifests and then
exactly
over with you?
Exactly. In the progress faster.
Okay.
In the take short time.
As you get and deal with it, you see the sign, and then chronic now,
they take time.
Take
long time before.
So at the initial stage, if you not go even know self say you get
correct.
And then through okay.
Yeah.
We don't really understand small. So we don't understand. So we get acute, we get chronic, we get complicated.
All right.
Okay. So
then we can also classify UTI based on the parts where they affect. Okay, as I say, if you affect the urethra, we call it urethritis.
Wow.
If it affects the bladder, we call it cystitis.
Cystitis.
Okay. If it affects the kidneys, we call it pyelonephritis. Nephritis. Okay. So if not that way, it's more simpler.
Okay.
So then the way affects kidney, the way we affect the pipe, then the way we affect the bladder.
Okay, so through this urinary tract infection, they affect three things.
Yes.
Okay, so we don't understand it. They affect the kidney, and they affect the bladder, and the last one they affect the
pipe.
The pipe. Okay, so now you take me through. Let's start with the pipe.
Okay.
How they affect the pipe and waiting at the damage when it cause to the pipe.
Okay, so the urethra, as
and
I
waiting
say,
self na the pipe.
The urethra and the pipe. I just use the word pipe because I don't want for the use the urethra for the confused people.
Okay, so we don't get urethra.
Yeah, that pipe inside it wet the common door. Now the talk. Okay.
Okay, sir.
That one I can call the piece hole.
Okay.
That thing we connect to that piece hole. Now they call the pipe for the urethra. Pipe for common people them. Urethra for we in a medical people them. Okay, as I say, as you say, I talk about urethritis. Okay, that means say it can get inflammation of the urethra. I'll call urethritis. Okay, boku thing them can cause the inflammation. As I say, bacteria them can cause virus them can cause them. Then certain, especially for women, there's certain things they will use can also cause that. Like if we use what we call diaphragm, okay, or use something spermicide. That we no one get belly, we do mommy and daddy business.
Then prevent.
Yeah, exactly. Then if we douche, we use certain soap and they for clean. You say, I don't want smell, I want make it clean. So then scented soap and they can cause inflammation of the urethra, and that they cause urethritis. Okay, that's not for the urethra. Okay, for the bladder, when cystitis, it mostly now from ascending infection. okay, and more common, as I say, in women. That's where the bacteria enter inside the urethra, and go up, it can colonize now the blood. So the blood is just like a bag, where they keep the urine. So where the kidney, the shifter, the blood, the waste, the urea, all, and they come out, pass through the urethra, the fluid, it can get under the bag going at the bladder. Say it full up, then you can get the sensation. Say you want wet, okay, that you void. So when this bacteria gets infect that bladder, it causes them for being inflamed. So I only make as one for the signs. I know, but I need for token because I wait first. So one part and symptom where person will get where it gets cystitis, they find out say it feel for wet fast because the bacteria they irritates and it inflame the bag. So they make the bone, so they get a sensation. Say I want wet, otherwise they feel for wet fast. The way you go back at times, you know the wet boku, because your bladder really not full up now because the bacteria they affect that bag there. So I make it the juice like you are wet. So we gonna small number they come where they feel for wet fast and so. So whereas also the kidney can get infected, as we said, through also ascending infection, pyelonephritis, okay? But that is not too common, but it can happen. Alright? That if you don't left and say the bacteria don't germinate, it don't colonize, it don't go into the blood and go. And once it affects the kidney, so mostly their infections they're not can present with fever. But one way how can, if not UTI, one way how can differentiate say this it don't reach the kidney clinically without to not do test mostly. Now if you come and you complain symptoms the way they in line with urinary tract infection, okay, then you tell you say your body the one. So that it tell you say systemic involvements don't come into play. Where mostly now where pyelonephritis can where the kidney can get compromised and infected. Now I can show up that way.
Okay, so of the three way you don't list, so which one is the most like dangerous or bad? Because from the bladder ion, seems so it's and then we come to the kidney ion, and then of course the pipe ion in the worst. But like to your body, because like we talk about the bladder, especially concerning people that will wet fast and all. I wanna know like is it just that because probably person don't get no, you just take that way they say sorry, you understand? So certain things them, especially we in Africa, we need to take certain things them too big, we need to go for checkup, we need to self and all. So like we don't take and say now so me body day. So like if person gets that carefree mindset, now so me body day, now so are they how then with itself they also go affect them in the long run?
I'll wait him. I don't get the question.
All three, the pipe infection, bladder, and the kidney. How it go affect her in the long run? Is it that there will be need for surgery, or is it that it go probably damage organs them in body?
So you did try for push me now to the complications.
Okay, yes, okay, yes, let's go to the complicated side. So we don't talk about the acute in a quick.
Okay, so
sharpshooter.
I think say the complication for don't come last, okay, but I'll just go through the signs and some of the signs and symptoms before we come to the complication always for the last. No okay. So some of the signs and symptoms of urinary tract infection, as I mentioned, are what we call urgency. That you feel for wet now. Like if you know wet now, no problem. At times, if some people can mess up their pants, they can wet. Okay, not able to control at times. But you say you don't. Then, as I say, you feel for wet fast. Okay, you get that urge and frequency. The way you go wet, you find out say not the common boku, better wet not the common. So according to studies where they find out say 90% of women they get urinary tract infection. Yes, 90%.
Wow, that's a lot.
And mostly can be asymptomatic. That's they get sign except for what we call dysuria. Okay, we're waiting at this dysuria. That's where the wet in the bone. You feel like it's in the way it's in the bone where they come up.
In all cases, like Now all them.
No, now I make I use the word asymptomatic.
Okay,
Except some can get dysuria, as I say. Okay. Except some can get dysuria.
Some.
Okay. So the one that we can get dysuria, like whether they wet, it just can burn normal them, but you know the warm, they know they get discharged, they know they scratch. So mostly the woman they can tend for waiver of say, I'm okay, not an infection, maybe not occasional something. Okay.
That's okay, though.
So now let me make screening and regular checkup and follow up very nice. More like we country now the norm now that now for let we sit on our boss. Some kind whoever knows who I come up from can tell you say this is good for element all the sickness at the body. This way you take care element that the wet you waiting the steady and all the people and buy.
We are guilty.
So that's not very bad practice. Okay. And I think say the pharmacy, but because they're not to the doctors they role, we get share the responsibility. Then at the pharmacy board the young place for that. I think say greater measures than for put for stop people, because you see when you take counterfeit drugs it cause more harm than good. It cause more damage to the system. Now that make if you go na corner right now you find out say first there are old people that get kidney problem. Now it may be more common in, but now it's so common in young people. Kidney problem, heart problem, liver problem. Not only the drugs where they take, although some they into what we call illicit drugs. Okay, they're recreational drugs the way they can take like kush and the rest. But some of them are then fake medicine them where they can buy from whosoever and wherever where they can take, and they compromise the system. So it's nice for make you before you take medicine. Now make why they can't talk like I say I don't mention no medicine name, because I don't want to encourage you to say, hey, one doctor we talk and say why they wet, make I go buy Panadol, then you go buy no. Because why we not go do that? Any professional not go do that. Most of them signs and symptoms they can happen to other sick.
Yes.
It not say what you call in medicine pathognomic. It not specify saying that this sick no more getter. Okay, then keep overlap. Except we do history taking, physical examination. Then we do test them in their lab workup before finally you'll be able to get a definitive diagnosis. Say now this now the problem. Okay. So you see I can't mention medicine, it not go help
at all.
In fact I do more harm than I do good, because it not necessarily means in that. As we say, even STIs can cause this UTI. So for example, if somebody get gonorrhea, get syphilis, it also could present with dysuria. Okay, it also could present with urinary urgency. So except we do the test, all right, then we can able to conclude saying okay at this. So I make you find out say antibiotic resistance is high now in a saloon, because I see somebody that say, hey, me want me have amoxicillin I take. Yeah, take them. So you find out say because you give the wrong treatment and you underdose, the bacteria that they develop resistance to that medicine. So you find out say when they take amoxicillin 500 they work, well now it not the work because you not take out the appropriate way, then not to the right one for the bacteria will be involved you take, so you don't develop resistance. So they tell what you need them and not the work, and you cause more danger for yourself.
Wow, I think cities are well guilty actually. Yes, we all don't underdose and sometimes they overdose we self. And they would all self-treat we self. Exactly. We don't get this. Anyway, I don't know if not afraid with the free doctor in hospitals there.
Yeah, most women can talk to now, they can say.
Yes, I don't know.
They say when they go to hospital, they go get
they go getting call sick and exactly we they afraid if they call the name, you never pronounce us.
But I think say the earlier the better. You know, you see most of them, as I say, they end organ damage or kidney failure as the rest. Not to sickness the way they happen one go mostly they not can happen one go, it take time. But if we're able to pick up earlier, we can stop that end stage where we're not able to do nothing again, and I'll just wait now, let God work me record.
Okay, so is that the only sign and symptom
For
bladder or
So like I know we don't do
No, you know we don't do
okay.
it.
So I just dey give them holistically, so I know they differentiate bladder
Yeah.
or what.
Just
what.
highlight.
Uh-huh. So urgency, dysuria, then you get frequency. Okay, then you get inflammation. You can get what you call suprapubic pain or tenderness. You see bottom belly, the heart. Okay. Then
I think so. That ain't common. I think that I mean we all don't know that side.
then you can get flank pain. So especially if not the kidney involved. So we get what we call renal angle tenderness. Where the touch here. You say bone or between you say rib stop, then don't you say response that space there. So you get where the neck, the patient say why or they feel pain. That means the kidney mostly now can test on physical and clinical examination for see if the kidney don't get involved. And mostly if it doesn't happen, that means the kidney compromised. It don't get infected. It don't mean say they die.
It just means okay. So these infections and not they usually lead to death, but it just make your body become complicated.
Except if you left it until it go to the complicated stage.
Really complicated.
Very
stage.
complicated.
Okay, so
without treatment back.
And so you
because
need
it can be
for
complicated,
and then
especially if not to end organ, that if not to the kidney gets involved. Okay. But some of the impacts then can be lasting. If you left it until like for woman, it spread, it reached to the tubes, them the ovaries. It go tendency they say, especially for STI, tendency they say it will cause infertility that you're not able born.
Wow.
So even though you can get liver, I don't say no woman, no one live when not born. All woman go one for born in your own picking.
Yes. So speaking of bad self, I want to know like what's with already get infection, it affect the baby, and then if it's contagious to other people them outside, you know, especially let's say partner or something, because sometimes when they start sick, the weapons they get it, they don't want near the person if we sweat in pit or whatever it may be, they don't want near at all. So both the way get infection, especially in that complicated state. Is it that the sweat or whatever can be effective or?
Well, if now urinary tract infection specifically, what they talk about,
yes, right.
And not going to be transmitted through sweat, neither touch or contact. Okay.
Okay.
And you talk one very important thing about pregnancy.
Yes.
Pregnancy, in fact, the risk factor for urinary tract infection. So now they make as a routine. Where woman they go antenatal care or they get a medicine for infection. Okay. So because we get belly, you get at a higher risk than normal woman for get UTI, urinary tract infection.
Wow.
So now part of your routine treatment, okay, with the test and they treat you. Because if you get an, it go transfer to the pikin, it go affect that water and the membrane where they cover the pikin, we go lead to we go predisposed to chorioamnionitis. Okay.
What's that?
Inflammation. We get when the inflammation and the infection of the chorions and the amniotic fluid. So now two terms: chorioamnionitis, the amniotic fluid, and the chorion. Okay.
Okay.
I don't think so. We will break in a way.
Okay.
We possible. But that water, that one, we can come up. I know the amniotic fluid.
Yeah, I don't understand.
You not get belly, so you not gonna know.
No, I think I don't watch up movies, so I don't watch up movies. So I get idea.
Right.
So still on this topic though. You mentioned earlier that for me to conclude, say this person the infection they do or was not instead of any other sickness, one part thing they want to use do now for check history records.
Yeah.
So is it that it is also genetic? Is it that if your mama be get something, then you are liable or they at high chance or high risk for get yourself, or let's say they don't born you probably?
Well, I think say you misunderstand what you say. Okay.
Well, you say check history and most
so I say history. Well, for we medical people, I know say you plan for going to medicine. So from we medical people, we say history. Am I wrong?
History.
So I say you plan for going to medicine.
Well, I'm currently I don't do pursue and small.
Okay, you don't do pursue. So in medicine, we will say history taking. Now that's like what they ask you, waiting that you name, waiting that you age, that begin ask you. waiting at the complaint, though, you tell me, say, me doctor, me belly the arts. They ask you, how long this belly done the arts?
Okay.
So now history taken in medicine.
Okay.
But notwithstanding, you get we get congenital abnormalities and where they can born certain people where the urethra and the urinary tract not the develop fine. So then they can predisposable for infection. Okay, because outside wet for common and not develop fine. So then they at a higher risk of infection. But waiting I be refer to that history taking at that question the way they go to hospital like it's right for
you better clear the air. So what happens if we get the same thoughts as me anyway. Okay, so actually one can go to these solutions. Well, as you say, you know, we mention medicines, right? But earlier you say you don't left bunya for we, so one can't take that bunya before we go to the solutions. You say we talk about the complicated. You say now that you want to end with.
Yes.
So yes, move can to that side. Move can take bunya.
All right. So the complications. Okay.
Yes.
So if now the urethra gets complicated, gets compromised, as I say, we get what to call urethral stricture.
Urethral stricture.
Yeah. In other words, it's just like where you wound your skin, where it well, you know, say it form strong cover, not so. So that strong can that way it form. Now the urethra and I not like use the skin and the cells that we did not like the one are you outside. God make this for out for strong for the thing and they.
Okay.
So whether they get where a wound, where a well, that scar where they form, you know, they stretch again like the pipe with the inside the urethra.
I think yeah.
Okay, you know, they stretch. So where that thing they form over and over, we get recurrent infection. You don't wound in the well, the wound in the well. So it is strong and it stretch again. So now they make you can see some man they get something like blockage. The penny force before wet come out because that road there where the wet for come out. You don't the wound, you don't narrow. Okay, you don't get constricted. Okay, now we call urinary stricture, and that one day in the mix let the bacteria able to germinate and infect more. Because since urine flow it become small what we call stasis, you know, they flow through that pathway well, so that they go catch they and multiply and cause more harm. Okay, so if na man then it can affect the cause predisposed for affect the prostate gland where they lead to prostatitis. And with time, you will say they don't pack that man in.
Now, if that's not killer more,
okay.
You will don't go through trauma. Or you they go through depression. Now for joining and this program here, so we go give you tips them and what you for do, what you for eat, and what you not for do for make you get well body and self we go to go now gym for go exercise.